It's Yasmin Tanras here with Long Beach Local News. It seems to be that in the past year during the pandemic, a lot of people have been missing their mammograms, bone density tests, in general, a lot of screenings. So we're going to find out as to why those are important. We're going to be talking to Medical Director of Breast Imaging at Memorial Care Long Beach Medical Center, Dr. Angela See.
Screening mammography really is recommended after the age of 40 annually. It's very important to get an annual yearly screening mammogram after you're 40 because it's been shown to decrease the mortality from breast cancer. And certain women need to get screening mammograms earlier than 40. Women with a strong family history, women who have had prior radiation therapy to their chest, and women who are BRCA positive, who have been shown to be breast cancer gene positive. Also, we recommend MRI exams for screening in certain women who have a greater than 20% lifetime risk for breast cancer, based on our risk model that we calculate here. So every woman that comes in here, we calculate a risk for breast cancer, a lifetime risk value. And if the value is greater than 20%, we recommend additional screening with breast MRI, offset by mammography by 6 months. So every 6 months, they're getting a screening exam, alternating between mammography and MRI. Trans women should come in for their screening mammograms. They should have annual breast exams and for all intents and purposes, just do screening just like any other woman. The difference between a 2D mammogram and a 3D mammogram is that the 2D mammogram superimposes all the breast tissue onto a 2D image. That's the traditional old-fashioned type of mammogram. 3D mammography, what it does is it takes multiple images of the breast tissue and it shows us slice by slice the breast tissue in incremental levels. And so it's much more sensitive and specific than 2D mammography in that it detects smaller cancers, more cancers, and it decreases the false positive rate for callbacks. 3D mammography really is sort of looking at the breast like an open book and seeing the pages in the book. 2D mammography is more like looking at the cover of the book and wondering what's inside the book. And so 3D mammography really sort of lets us evaluate the breast tissue in a much more detailed way than 2D ever does. All women qualify for a 3D mammogram, and 3D mammography has been shown to be improved in terms of finding small cancers in all women, no matter what their breast tissue density is. And we encourage all women to get a 3D mammogram. Most insurance companies will cover 3D mammography, and Medicare definitely covers 3D mammography. We've made it as streamlined as possible, streamlined and as safe as possible as well. We have social distancing, and we're having ladies change in the mammogram rooms instead of the dressing rooms, and so we've made it as safe as possible. We're implementing extra cleaning procedures as well, and so it's perfectly safe to get your mammogram. And the danger is that cancers that are found by palpation or by symptoms are known to be larger in general than cancers found by screening mammography. And when it comes to breast cancer, smaller is better. So screening mammography really finds smaller breast cancers than those in women who wait until there's a symptom. It's very important to get your screening mammogram because that's really the only exam that's been shown to decrease the mortality from breast cancer. Bone density is extremely important because as we all get older, we lose bone density, bone mass naturally. And even though it's something that we might not think about, it does lead to a lot of problems, especially in later in life with broken bones, broken hips, broken spines. And so it's something that we should all really keep in the back of our minds as something to keep track of. We have one of the newest state-of-the-art bone densitometry machines here, a Hologic machine that is very fast, very good, very accurate, and It's something that people should get a screening exam every couple of years after age 65 or so. All they do is just lie on a table. It's completely painless. There's no significant radiation, and the technologist doesn't wear a lead gown or anything, and all they have to do is lay down. Before age 65, some of the things that might indicate that you need a bone density exam are ovarian failure, meaning estrogen deficiency, premature menopause. If you have other coexisting diseases like primary hyperparathyroidism or Cushing's disease, certain medications also might predispose you to early bone loss. So it's something to discuss with your doctor whether or not you might need a bone density exam before age 65.
There you have it from Dr. Angela C., who highly recommends you coming for a screening, especially if you're in your 40s, start to go in for a mammography, and if you're 65 or above, take a bone density scan as well. Now you can head on over to memorialcare.org/LB-breast. I'm your host Yasmin Tamras on Long Beach Local News. Check out for more local news on longbeachlocalnews.com.